position. All right. Welcome to what seems like a daily update on COVID-19. I want to give you who's going to be speaking today. We'll have Mayor John Cooper, Dr. Michael Caldwell, our Director of Health, Alex Jahangir, Dr. Alex Jahangir, and Colin Reed, the Chairman and CEO of Ryman Hospitality Partners. I would also like to recognize Representative John Ray Clemens, who is with us today. Chief Swan from our fire chief is here, as well as Chief Council Member Swope, and as well as Butch Spiriton, who's the President and CEO of our Nashville and Convention Visitors Corporation. With that, I will turn it over to Mayor Cooper, and at the end of these remarks, we'll open it up for a few Q&As. Thank you.
Thank you very much, Brian. I hope you can all hear me. Thank you all for being here, and I'm just incredibly grateful for the people behind me. Dr. Jahangir, Chairman of the Metro Board of Health and the Metro Coronavirus Task Force, Dr. Caldwell, our Public Health Director, and then Tim Adams of St. Thomas Ascension, Dr. James Hildreth of Meharry Medical College, Dr. Wright Pinson of Vanderbilt University Medical Center, Heather Rowan of TriStar HCA, Dr. Joseph Webb of Nashville General Hospital, and then Colin Reed, CEO of Ryman Hospitality and former chair of our State Tourism Board. Now I want to first announce some good news for our residents who continue to recover from tornado damage. Metro Water Services and NES has agreed to suspend all disconnects until April, and we are working to push that date back. Piedmont Gas is providing flexible bill payment arrangements for customers experiencing financial hardship. Comcast has agreed to suspend account fees, including late payment and missing equipment fees. AT&T is waiving overage fees in affected zip codes, suspending collections, and offering payment arrangements as needed. And the Davidson County Sheriff's Office will suspend eviction enforcement actions until further notice. Now, for more important information about these grace periods, visit nashville.gov. We are happy to report that these organizations are helping our affected residents recover. Now, I'm grateful to be joined by representatives from Nashville's leading hospitals this afternoon. Nashville is strong in part because of our thriving healthcare industry, and we are, in fact, the healthcare provider capital of the world. Not only are our hospitals and healthcare providers some of our area's largest employers, there are also critical partners in our coronavirus monitoring and response strategy. Now, for months, these healthcare partners have worked closely with us to prepare for the coronavirus disease in Davidson County. And I'm thankful for their dedication to public health and for the many countless healthcare workers on the front lines of our response strategy. Now, since the Metro Board of Health convened yesterday to declare a public health emergency in Nashville, MGM Resorts International and Wynn Resorts have also decided to close Las Vegas properties as of tomorrow. Our neighbors in Kentucky and Ohio have closed or placed restrictions on schools, bars, and restaurants, and many other states and cities are following. Even Chicago bars have been ordered to close on the eve of St. Patrick's Day, no less. In Austin, as we know, South by Southwest was canceled. The Masters golf tournament has been postponed. The March Madness has called off. And every major professional sports league has stopped or indefinitely delayed their 2020 season, all in the name of public health. The bottom line is that we are making health decisions that are both in line and on the leading edge of best practices nationwide for the sake of protecting our community. And again, the decision to declare a public health emergency, temporarily close bars, and place restrictions on restaurants in Davidson County are serious public health decisions. But these are also short-term solutions that will make a tremendous long-term difference in flattening the curve of the spread of the coronavirus in our community. We're making public health decisions with safety and well-being of everyone, every member of the community in mind, from cooks to customers alike. I'm grateful to all those businesses and organizations who've already implemented social distancing protocols to protect Nashvillians. We are keenly aware that business owners and employees will face hardships, and my administration is focused on trying to provide relief for everyone who is impacted by the coronavirus in all the different ways. But a coordinated response is the most effective response. A consistent response is the most effective response. And we must be united in our efforts to mitigate the spread of coronavirus if we are to succeed in keeping our community healthy and getting us back to normal sooner. And with that, I would like to turn this over to our Public Health Director, Dr. Caldwell. Thank you.
Good afternoon. Thank you, Mr. Mayor and partners. Today, we have a total of 24 cases of COVID-19 in Metro Nashville. This is 7 more than yesterday. The age ranges are from 11 to 73, and only 1 is currently hospitalized. Yesterday, the Board of Health took a major step in our community's response to COVID-19 by passing an emergency declaration. This enables the Department of Health and the entire community to flatten the curve of the growth of the virus in our community by limiting people's exposure to the virus, by limiting people's exposure to each other. The faster we take action, the faster we can return to normal. I have been in meetings this morning drafting orders, Director of Health orders, with my Division of Environmental Health, as well as our legal department, in partnership with many other Metro departments, including law enforcement agencies. So immediately, as was discussed yesterday, all bars on Lower Broadway and throughout Davidson County are to be closed. Restaurants are to limit their regular maximum seating capacity to 50%, with no more than 100 patrons allowed at any one time. Restaurants are defined as public facilities where food sales are more than 50% of revenue. Bar service at restaurants should also be limited to 50% of capacity with no standing allowed. Takeout is encouraged and is an option to help both our community as well as those restaurants and food service partners who are also struggling. I have seen a great amount of voluntary compliance. Within 1 hour of the Board of Health meeting last night in the field, word was already out. Enforcement was already happening voluntarily at sites that I visited. And again today, a place that could allow patrons decided not to allow patrons and just allowed walk-in. So to all of you, I say thank you. Thank you for helping us. Thank you for voluntarily complying. We want you to know that our guidelines also comply with what CDC has recommended, even though they have issued additional guidance on social gatherings. The action taken yesterday is aligned with everything else that is going on in the country. We are in daily contact with the CDC, and we will continue to follow their guidance and evolve our guidance with the State Department of Health as well as the CDC. Let's remember, this is a time that we need to be as healthy as we can. We want to strengthen ourselves in order to limit our exposure, and if we are exposed, what this virus could do to us. So if you smoke, it is time to stop smoking. CDC is asking you to please stop smoking, and we will also help you. If you have not gotten your flu shot yet, the flu shot is still available in our community. This year has been one of the most severe flu years There have been 136 children that have died of the flu this year in the United States, 11 in Tennessee. It is still here. That is one additional way that you can take to protect yourself. What you do affects other people, and what other people do affects you. Remember, those most vulnerable, the elderly, those with chronic diseases, we need to protect them in the best way we can. We need to distance ourselves physically from them, but not socially. They need to be in contact and in communication with us, probably now more than ever. You are not alone. We are working together. This city is pulling together. Healthcare community is pulling together in a way that it has never pulled together before. And I'm pleased to now turn it over to Dr. Alex Jahangir, the chairman of the Board of Health, as well as the chair of the Coronavirus Task Force. Thank you.
Thank you, Dr. Caldwell. Good afternoon. My name is Alex Jahangir. I am the chair of the Metropolitan Board of Health as well as the chair of the Metro Coronavirus Task Force. In our efforts to contain the virus and limit its spread and impact on the citizens of our city, we are taking the following steps to help flatten the curve of growth. First, we are working to establish a coronavirus hotline for the residents of Davidson County. Secondly, we are working to establish assessment centers that will enhance the already hardy system of assessment centers in place in our cities because of our great hospital partners and care facilities. None of this would be possible without the great help of our hospital partners. From day one, these hospital CEOs and leaders have understood the complexities of preparing for this virus. I would like to again join the mayor in expressing my gratitude for the support that Mr. Tim Adams, Dr. Hiltheridge, Dr. Pinson, Mr. Rowan, and Dr. Webb have provided to us as a task force and as a city. This coordinated response is critical to the success of the city. We have met daily over the past week on ways to expand the assessment services that are already being offered in this city to our hospital partners' patients. Later this week, we plan to have the hotline available for our citizens to call. We also plan to have the assessment center staffed up and available to assess residents who are referred there by the hotline. In these challenging times, we will be as transparent as possible regarding our efforts to contain the growth of this virus. These assessment centers will not replace the services our great hospitals are already providing, but will supplement them. They will be strategically located in the county so we can provide the best access to all our citizens. We are working as fast as we can around the clock to get both the hotline and assessment center staffed up so we can have a smooth rollout. As soon as we have the details on the assessment centers and the hotline, we'll share it. In addition, we want our citizens to be informed about our efforts surrounding COVID-19. We are finalizing a new Metro website to help our citizens better understand this disease and answer the questions they may have. It will be one place that includes relevant information from the city, from the hospitals, and our community partners. It will include updates on city utilities, public safety, parks and recreation, schools, and transportation services. And we will provide continual updates to that website. You can also obtain information on the coronavirus on the CDC website at cdc.gov. We're working on the website and we'll launch this in the next day or so. The hotline, assessment center, and the website will go a long way in helping our citizens. I want to thank Mayor Cooper, Director Caldwell, our healthy community, and our community leaders for their support. I'd also like to turn it over to one of our business leaders and partners, Mr. Colin Reed.
Good afternoon, everyone. And these are difficult, dark times for not only this community, but this nation and the countries of this planet we live on. This virus is terrible. Over the last few years, Butch, I suppose, we've grown this city into a entertainment and hospitality powerhouse. People all across this country and all across the world look at what we do here because we are a leader in this area. And my personal view is with leadership comes responsibility. My company, just to put this in perspective, this is not pretty. We own 5 of the nation's top convention resorts, including the one on Briley Parkway. But over the last 3 weeks, my company has lost $3 billion of market cap because the perception is no one's in our hotels, which is in fact reality right now. No one is meeting in these hotels. We, as a company, I suppose, have the most amount of capital tied up in the hospitality business in Nashville. And as such, we believe as an organization that we need to lead by example. So that was the reason why last week when we were talking with the doctors in our community, and Dr. Pinson knows one of my dear friends is the gentleman who runs Vanderbilt, it became clear to me that bringing people in thousands together in places like the Opry House is not a good thing in this environment. And we needed to get out ahead of it and do it, and we did it. And last Saturday evening was I think the last time the Opry played in front of zero audience. Actually, it had one in the audience last Saturday, and that was me. But the last time that happened was the day after Dr. King got assassinated. So we as an organization very much applaud the initiatives that are being taken here, not only by the world-class doctors we have in our presence, but with the actions the mayor took yesterday. We believe that if we are to beat this thing, we have to stop people kissing and hugging and loving and dancing and partying for a short period of time. Because if we don't, we will not be able to bring this entertainment community back together in the foreseeable future. My hope is that these actions that have been taken will allow us, hopefully, to do the music festival in early June, and hopefully, bring the millions of tourists back to this town. So, Mayor, we support every action you've taken here. This is very difficult times. Our company has made decisions to look after its people. We've, for the folks that we employ in Ryman, we're going to continue paying those folks for the next month at least, and we believe that's the right thing to do. It would be naive of me to say that there are many, many small businesses out there that can do the same thing. They can't. And my appeal to the leadership of the state of Tennessee is to figure out a way in which this state supports the men and women who come to work to generate so much economic wealth to the state of Tennessee. This is a big deal. Nashville makes up approximately 35% of the hospitality industry of the state of Tennessee. This is so important to the financial well-being of the state. We've got to figure out how we help the folks that make that happen. So, Mr. Mayor, they were my comments. I hope they weren't too inflammatory. Thank you very much indeed.
Thank you, sir. So now first of all, I'd like to recognize David Frederick. He is one of our board members, along with Dr. Jahangir. So after, what we'll do next is we'll have an opportunity to ask questions for Dr. Jahangir, Dr. Caldwell, and the mayor. And I'll start by calling on Yi-Hoon at the Tennessean. Do you have a question?
Can you confirm reports or just allegations that maybe a homeless teen has been, verified to have symptoms of the virus and has been exposed?
No, I don't have any information on that.
Just a quick follow-up. Can you
Yep.
talk about maybe some measures focused around a population who are experiencing homelessness in the city?
I have been very dedicated to the homeless population. Well before I even started this position last week, I worked on the point-in-time count, and we are coordinating with all of our homeless coordinators to check in on them. That's all I could say at this point. Thank you.
So Next up is Kathleen Siri, and then we're going to go to you, Nancy. Kathleen.
Yeah, so we're just hoping to clarify some of the language regarding the decisions to shut down bars and to limit the people in restaurants. Is this a recommendation, just kind of something that you guys are recommending that these businesses do? Or is this a hard and fast rule that they have to follow for their
Yes. Thank you for that question. I'll clarify that for you, that a number of businesses are permitted by the Department of Health, bars, restaurants. They will be ordered to make sure that they fulfill these requirements. And I'm drafting orders to make sure that that is done, that the information is transmitted to them directly, and if they have any specific questions, that we will work with them one-on-one. There are many entities throughout Davidson County that are not directly permitted by the Department of Health, but this emergency order provides the Director of Health and the Department of Health to also have additional restrictions if needed, and we will communicate those as they are developed. Right now, we want to amplify what the CDC has said, which is that there shall be no gatherings more than 50. That's their recommendation. Now, they did exclude educational institutions and businesses. So we are on this pathway to reduce our physical distance from one another. There may be more additional specific orders of what to do. We will be drafting the order, presenting the order. We were going to find that most are already voluntary complying. For those that are not, we will take appropriate action, as we always do, for any permitted facility that may not be following public health rules and regulations. So thank you.
Nancy, you're up next.
To follow up on that, are you saying that you'll have their health limit full if they don't comply?
We will take enforcement action that is necessary. They will be presented in order of what they are to do and how they are to do it, effective immediately. And we will work through our normal operating procedures through enforcement action for permanent facilities. So it potentially include that as well as a final, perhaps, solution. Thank you.
Peter.
Dr. DeHander, how are you doing on the capacity for testing? And a related question, how much capacity do you think you're going to need before we do, wide-scale testing as they have done in other countries, to throttle this thing?
Sure, I'm so glad you brought that question up, because we talked about it last week. And as I mentioned last week, the answer of how many tests are available is a little tricky. And the reason it's a little tricky is because there's just not one entity that does testing. You have several private labs. You have several medical centers locally. You have the state. And testing can occur in a clinic. It can happen in a hospital, and so forth. With that said, what I've been able to gather, speaking to our hospital partners, and I just want to highlight, this is hospital partners. I can't access, private clinics might have sent a test to a private company or something. But thus far in Nashville, over 1,300 tests have been conducted. And I think what I want to reemphasize is assessment is what matters, okay? If you believe you have symptoms, you need to be assessed. And to my knowledge, anyone that has been assessed in this city, anyone that feels that they have issues, can get access to an assessment. Now, when they get assessed, the healthcare provider who assesses them based on CDC guidelines and other guidelines can say, you need to get a test, or maybe you need to get a flu test, or maybe you just have hay fever. And I think that is the key, the message here is assessment is vital, and I need you guys as partnership, you guys, the media, to help me get that message out. Assessment is key. I feel our capacity to perform assessments, and if needed, other steps per guidelines, I think it's going to be pretty good. I think it's good now, and I think as we scale up, it will continue to remain that way.
Last follow-up on the epidemiological stuff. Is that a state thing you're expecting to get done, or are you going to do that?
Right.
To track this thing scientifically, you need to give a lot of tests, and there's supposedly going to be a lot of them available, but we don't know when.
Yeah, so regarding...
Handle that. Are you going to handle that?
No, so the state of Tennessee has a very robust epidemiology, the health department, and I would defer to them for the epidemiology around this.
Okay, that's all the time we have for questions now. We do have Dr. Jahangir, Dr. Caldwell, and the mayor that are available for one-on-ones if you'd like to have those. Thank you.
Okay, thank you.
Thank you.
Yeah.